Last year, a British traveller died after being bitten by a stray dog in Morocco. I'm Harshika, a specialist travel health nurse at Health Klinix, and this is what I'd want every traveller to know before they go. Morocco is one of the most popular trips UK travellers book every year, and today I'm talking you through what you need to know before you go. The vaccines worth having, the risks that are easy to miss, and the small habits that keep a trip like this running smoothly. Now here's the bit people always ask me first. Do you actually need any vaccines to get into Morocco? And the answer is legally no. There's nothing you're required to have to enter the country. But I always say the same thing to patients. Just because something isn't mandatory doesn't mean it isn't worth having. So let me talk you through what we'd recommend and why. Let's start off with hepatitis A. Because if you're going to Morocco, you're eating out. And that's half the fun of it. The souks, the food stalls, the markets. But that's also exactly how hepatitis A is spread. It's a liver infection that comes from food or water that hasn't been handled quite as hygienically as we're used to. It can cause jaundice and leave you feeling unwell for weeks. The good news is that the vaccine's well tolerated. This is something that we recommend to almost everyone heading to Morocco. Next up, typhoid. This is also spread through contaminated food and water. If you know you're going to be eating out a lot, wandering through local markets, heading somewhere rural, or staying with friends and family where you're not fully in control of the food prep, this is one worth having no matter your accommodations. And there's flexibility here too. It comes either as an injection or capsules you take orally, so we can talk through which ones fit you better. Then there's MMR, measles, mumps and rubella. Since late 2023, there's been a serious measles outbreak there. And it's not localised, it's spread across all 12 regions of the country with over 25,000 suspected cases and close to 200 deaths reported. The vaccine is in the UK's routine immunisation schedule. So, if you're not 100% sure you've had both doses, that's exactly what we check at your consultation. Diphtheria, polio and tetanus is a combined vaccine that protects against those 3 bacterial infections. Make sure your routine boosters are up to date before you travel. The combined vaccine is available free on the NHS, and we can also provide it at Health Klinix if you prefer to get everything done in one appointment. Now, hepatitis B. This one spread through infected blood and bodily fluids, so it becomes relevant if you might need any medical treatment while you're out there, staying long term, or your trip involves anything with an exposure risk. Since they introduced newborn vaccination back in 1999, prevalence has dropped from about 10% of the population down to just over 1%. That's a huge public health win. But it hasn't been eliminated completely, so it's still worth thinking about. And we offer it either on its own or combined with hepatitis A, so you're not having more injections than you need to. And then rabies. Morocco has a large population of stray dogs and cats. You'll see them everywhere in the medinas and out in the rural spots. And last year, a UK traveller actually died from contracting rabies from a stray dog while abroad. Pre-exposure vaccination matters so much here. It gives you protection before you're even exposed, which is especially important if you're somewhere remote and can't get to a clinic straight away. This is particularly relevant if you're trekking, travelling with kids who might go to pet an animal with it without thinking, or spending extended time away from major towns. And if you are bitten or scratched by any animal while you're in Morocco, don't wait it out. Get medical attention immediately. Tuberculosis is present in Morocco, spread through the air by coughing and sneezing. For most short-stay tourists, the risk is low, but increases if you're visiting friends or families, staying long-term, working in healthcare or spending time in crowded or rural settings. If any of that applies to you, we may recommend the BCG vaccine, so it's worth raising at your consultation. One thing people are often relieved to hear is that malaria isn't a concern here. Morocco was officially certified malaria-free by the World Health Organization back in 2010. Mosquitoes can still be around in some regions though, so basic bite prevention is sensible, particularly if you're near the coast or somewhere rural in the warmer months. Food and water safety is a big one. Tap water isn't safe to drink in Morocco, so stick to bottled water, including when you brush your teeth. Be cautious with ice, unpeeled fruits and raw salads. The food stalls in Marrakesh are a brilliant experience. Just go for the stalls where the food is cooked fresh and served hot, and keep hand sanitizer on you. Heat is another factor, particularly in the summer. Temperatures in cities like Marrakesh and out in the Sahara can climb fast, so stay on top of your hydration. Wear SPF 30 or higher and dress in loose, lightweight clothing that covers up during the hottest part of the day. The one thing I'd say more than anything else, don't leave this until the week before you fly. Some vaccines need multiple doses and some take weeks to give you full protection, so aim to book in 4 to 6 weeks ahead if you can. If your trip's coming up sooner than that, still come in. We can often use an accelerated schedule to fit around your time frame. I've written a full guide covering everything we've talked through today, plus more details on food and water safety and when to book. Links in the bio. And if you'd like advice tailored on your own health and medical history, you can book a consultation with us at Health Klinix. Thank you for watching, and I hope this helped.